Hey everybody, this latest edition of the Westwood Living Podcast takes us to the Carby Street Municipal Building. I've been here, but not in this capacity, and I want to introduce you to Kevin Myers, who is the public health nurse practitioner for the town of Westwood. Kevin, how you doing?
I'm doing great. Thanks for having me, Tom.
Absolutely. I've known you for a whole total of about 7 minutes now. So actually, we just joked about this. Sometimes those make the best episodes because I literally have just a bunch of curious questions. Your position, I didn't even really knew existed, right? So I have to pick your brain a little bit about how long you've been here, what your purpose is in the town. And I know through our mutual connection, Kristen Dewar, who does a lot of work over at the Council on Aging, the Senior Center, she said, you should talk to Kevin because he's got some really cool things up his sleeve. So we'll hit them one by one, but just a little bit about your background first. How long have you been here?
Well, first, shout out to Kristen. Thanks so much. I've been here in Westwood for about 6 months now. Having a long history of other positions, working in the hospital, community health centers, primary care.
So take me through the general purpose of this department, right? The people who work in this department, what is your mission and what are your responsibilities?
Well, the health department, I'm still discovering every day new things that I didn't know the health department did. So I'm a learner in that sense too, but around a safe environment, any sort of health-related housing complaints. We do food inspections for the town, summer camp inspections, another example. The public health nurse typically follows up on the communicable disease cases for the town. So when there's a new person who comes down with salmonella, if they've got a Westwood address, they're talking to me.
Got it. So what's your background? How did you end up in this kind of job?
How far should I go back, Tom?
I don't know, man. Whatever you think is most interesting. We're trying to keep the audience here. Come on, Kev.
I started as an EMT many moons ago, and that got me interested in healthcare in general and medicine. Came up from New Jersey, South Jersey originally. Came up to Boston for school, and they couldn't shake me. So I'm still here. I had some really formative. I went to Northeastern in their nursing program. I got my undergrad and my grad there, and I had some really formative experiences that solidified my interest in public health. Excellent.
Well, what you do is yeoman's work, and it is appreciated. And I know most notably on the calendar here, just a short time from now, May 20th, if I'm not mistaken, is a special fair that I know you wanted to promote a little bit and make people aware of what's happening on May 20th. So I turn it over to you to let people know what to expect on May 20th.
Thank you so much. So on Wednesday, May 20th, we're having the Westwood Community Health Fair. It's going to be from 1 to 4 p.m. in the afternoon at the Westwood Senior Center, 60 Manhattan Street, and we're really looking forward to it. We're gathering a bunch of local healthcare providers, and different public service organizations all in one spot. Our hope is to get some residents out to learn a bit from the lectures, interact with the exhibits, and ask questions, make those connections with all of the local resources that we have.
Now, because it's at the Senior Center, is the primary audience seniors, or is this something that you would like to see people of all ages attend?
Good question. So the programming isn't geared toward any specific age range. We are talking about topics that I think will apply to people across the spectrum. We'd love to see as many of our seniors come out as possible, and that would be great. But we'll be talking about Lyme disease, heart health, mental health. So things that aren't necessarily fall into an age category.
And you told me the time. What's the time again? Just
1 to 4 p.m.
Okay. And how big is this? I mean, you talked about a number of different people being represented, but how many different health professionals are going to be there?
We'll see. We've got a lot of people confirmed, and I'm hoping the turnout was great. I think that our organizations are going to show up for us. I know that they will. We have some really great partners in and around town, but I'm hoping that the word gets out to our Westwood residents too. Stop by.
Got it. So you're 6 months in. Just give me your assessment of the town. 6 months in, as you get used to a new job and a new community, what are the first things that have stood out to you about this town and the people in it?
Okay. Organized, clean, beautiful. That's just my sort of my sidewalk observation of Westwood. The people couldn't be more welcoming. I mean, there's a great team here in the health department, but I think the larger municipal group has been so welcoming and just a wealth of knowledge.
Isn't the senior center amazing? I mean, when was the first time you stepped foot in there?
I'd love to just go hang out there.
I mean,
I'm not
the people are great, the great energy. Lena does such a fantastic job
the team over
organizing everything. It seems like there's 3, 4, 5 different activities every single day.
Yes.
They're taking trips to Europe. They're taking trips all over the place. I mean, it is really remarkable. So your impressions of how integrated the Council on Aging is in this town.
I can't believe all the things they're doing at once, juggling everything. There's such a wonderful team over there. Like you mentioned, Lena, Mary Ellen, Rachel, Kristen. The programming is top notch. There's several things going on at all times, and I'd like to go hang out there an afternoon. I'd like to do a little watercolor, maybe a little crocheting, pick up some new tricks. I mean, they're really doing it all over there. And I read that newsletter every month when it comes out. There's hot tips in there. Comprehensive calendar. I mean,
and some characters. Do not undersell the characters when you walk into that building.
Well, the first time I went there, they weren't going to let me leave without taking some donuts.
Oh yeah, oh yeah. I understand. Yeah, the resources are remarkable. Now, people, if this was video, you would see us surrounded by so many boxes in Kevin's office. And first of all, never apologize when you're putting together what you're about to put together. But all of these boxes will ultimately lead to what?
We're gathering supplies now because as part of the health fair, we're brainstorming what's a good goodie to give people, something that's, an incentive to come out. And we all go to these conferences where you come home with a bag and some papers and pamphlets, but we wanted to make something really substantial. So Jared Orsini, our health director, had this idea of making an emergency kit bar where everyone gets their emergency kit box and then they can sort of shop around, fill it up with the supplies that they need. Flashlight, keychains, medical supplies, first aid kit, warming blanket, things like that. Things that you hope you're never going to need, but if you do, you want them easily accessible.
Oh, no. If you do, you just come to Kevin Meyer's office, apparently, because you have all of this stuff.
I'm stocked right now.
So the hope is that we get much of this out of your hands and into the hands of people who need it.
That's what I need to be able to walk in this office, and right now I'm having a hard time.
It's all good, but, you talked about being an EMT, so you've been right in the throes of chaos and emergency situations. What's your takeaway from that experience and how it changes your life?
Well, in healthcare, a lot of times we're meeting people on their worst day. Whether they've called 911, they're going to the emergency room at the hospital, whatever the case is, they're already not at the top of their game, physically, mentally, emotionally, the whole thing. So I think one huge takeaway of dealing with actual patients once I got in the field was just having that kind of compassion. Put yourself in someone else's shoes. Mm-hmm. How would I want to be treated?
Yeah.
How would I want someone to guide my mother through something like this?
100%.
Mm-hmm.
Yep. So, I mean, listen, as somebody whose parents came here for the end of their lives, we were very much impacted and grateful for the services of the people here in Westwood, starting with the fire department, the EMTs, everybody who would consistently respond. And these events happen more than you would even predict, because when you get old and you fall, like, you have to run through the whole gamut, right?
Yep.
You have to get everything checked out. And the first time it happens to your parents, you're like, wait, what's happening here? Like, why do we need to do that? And they're like, this is how it happens. Like, this is how people get sick. This is how people die. Like, you need to make sure there's no hematoma or there's no X, Y, or Z. So we are very grateful to the people who serve this town. What other life experiences have kind of shaped you? What ultimately drew you to want to go into this line of work?
Well, I mentioned that I went to nursing school at Northeastern,
Yep.
and a program they had at the time was this mobile health van that traveled across the state to different underserved areas. We provided free HIV and STI testing, helping people with insurance, referrals to primary care, mental health care, etc. So really looking for pockets where there weren't easily accessible services or the need was so great. And that experience, just traveling around the state, seeing different communities, the lack of services available, issues with health insurance, and even getting access to the system, just made me realize that there's a lot of work to be done in public health, and we have a very technologically advanced healthcare system here in the States, but in terms of access to that care, that gets trickier, and the solutions, I think, are murkier. So I wanted to get into a type of nursing where I can have like system level impact, ideally. I love doing bedside stuff. I love doing the one-on-one patient care, but this to me seemed like an opportunity to elevate that and apply what I've learned more to populations and communities than the individual.
Well, thank you. You're doing a great service. That's much appreciated by many people here.
If I just don't want to gloss over, we have some wonderful sponsors for the coming up.
Let's give some shout outs.
So thank you so much to Fox Hill Village, Mass General Brigham Westwood, and to the BID Needham, who have been our collaborators and sponsors on this and are helping to make this thing possible.
That's fantastic. Yeah, you can't do things like this without support like that. So it's great to hear that everyone's engaged.
Truly takes a village. And that's not to mention the Norfolk Rec Department, all the folks at the Senior Center who have contributed their expertise and their event planning knowledge and their resources to help us make this come to be.
And their energy. Right?
Yeah.
That's what you need. You need people's positive energy to make something like this happen. So I'm looking forward to it. It is May 20th from 1 to 4 p.m. at the Council on Aging, which, of course, is on Manhattan Street, the Senior Center. And go check it out. You get to learn a lot, and maybe you get yourself a little emergency health kit.
Yeah, take a picture. Take a picture with Jessica, our little mascot.
What is that? It looks a little bit like it's a spider with a wig. Kind of looks like Beaker from the Muppet movie.
Oh, no. Someone told me, I can definitely tell what that is. So what you're looking at is a model of an Ixodes scapularis tick, female tick.
Oh, it's a tick. Okay.
It's a tick. And these are the ones who are going to be the guys that get you Lyme disease.
Yeah, we ain't got no time for that.
Yeah.
No, we don't want to. I don't want a picture with that.
But if you want to hear more about how to prevent tick bites and tick-borne diseases, come on out to the health fair.
Okay.
We're going to learn all about it.
Can you give me a little hint, a little teaser here? What are the big keys to avoiding a tick bite?
Well, DEET, 30%.
Yep.
Is very effective.
Okay.
So products that have DEET in them. You want to wear your socks up as high as they go. Tuck your pants in if you can, especially if you're going to be walking around in wooded areas. You want to check your pets when they come in.
Oh, yes.
Check yourself. Wear light-colored clothing so the ticks show up better. Things like that.
It is something else. I've had a tick show up on my dog, and wow, when that thing gets engorged.
Oh, yeah. Yeah.
It looks a little like your mascot. Well, that's cool. That's Kevin Myers, who is the public health nurse here for the town of Westwood. And again, it's May 20th from 1 to 4 at the Council on Aging. So come on out, meet Kevin. Obviously, very gracious and nice person. So still settling himself into our community. So just 6 months in, come shake his hand and get to know somebody new. So we appreciate your time and good luck. And if there's anything else we can do to help you out, please let me know.
Thank you so much, Tom.
All right, that's Kevin. I am Tom Leyden. As always, if there's someone else you want me to have a conversation with, just send me an email, tleyden@bestversionmedia.com. I will find that person, have a conversation with them, and then share it with you right here on the Westwood Living Podcast Network. But for now, with Kevin, I'm Tom saying so long and thanks for listening.